Hello, I'm Carl Tyler, the president of the American Academy of Developmental Medicine and Dentistry, and I'm pleased to greet you on the first session of the virtual grand rounds for the academic year 2022-2023. And I'll turn the mic over to Sophia Sorrentino, who is student representative, the VGR student chair. So Sophia, welcome.
Thank you. Welcome to Virtual Grand Rounds. My name is Sophia Sorrentino. I'm a second-year podiatry student at Scholl College of Podiatric Medicine in Illinois, and this year's American Academy of Developmental Medicine and Dentistry's Virtual Grand Rounds chair. For those that are new, Virtual Grand Rounds are a webinar-based presentation model that creates a space for mentorship and exchange of knowledge and experience between seasoned IDD providers, entry-level clinicians, and future healthcare providers in training. The purpose of the Grand Round sessions is to expand and strengthen the IDD healthcare workforce across a spectrum of experience levels. If you have any questions throughout the presentation, you may write your questions in the Q&A box on the sidebar, and we will go over as many as we can at the end. If we do not get to your question, we will post it on the website afterwards. Now, I would like to introduce our speakers today. Dr. Seth Keller, a New York-based neurologist who recently visited Ukraine, Marisa Brown, a clinician and health advocate for individuals with IDD, who has also recently spent time in Ukraine, Dr. Vadlina Sanikova, the medical director of City Children's Hospital No. 5 in Kharkiv, Ukraine, Dr. Yulia Snyder, a pediatric neurologist from Ukraine, currently practicing in Rochester, New York, Helena Kurlio, a Ukrainian women's rights and disability rights activist, David Evangelista, the president and managing director of Special Olympics Europe Eurasia, and our moderator, Nancy Thaler, a national leader in public policy and program development for individuals with disabilities. Thank you for presenting with us today. I'll hand it over to you now.
Thank you very much, Sophia. It's a thrill to have everyone on, and I know that we are having people from all around the world and even from Ukraine. So the world is smaller every day. And I'm a neurologist, and I'm the past president of the AADMD and the co-president of the National Task Group. And it's so important that us around the world and in the United States understand about how people with intellectual and developmental disabilities live their lives or challenges that they may face. And the effort that I actually had been on with Disability Rights International, I had been there to support the mission to Ukraine in June. And so part of our conversation we're going to do today is really talk about the healthcare crisis for those with intellectual and developmental disabilities in Ukraine with the backstory of the war. And obviously for those that are on the call, you know what's going on in the war, but we're really going to hear stories by our colleagues today, both from in Ukraine, those that have visited Ukraine, those that are sensitive to the issues of Ukraine for they themselves about what's going on. Can you pull down the map for us, the next slide? So we wanted to really, again, we're going to probably come back to this map and give our friends and colleagues watching and those that are participating about this. And the one thing that, because this is an international presentation, we did want to be sensitive to language barriers, but unfortunately for planning, I'll take some of that and not having enough ability to fully be able to translate. So we're definitely going to have multiple conversations in this webinar and other webinars to really have a better translation of those that may not fully understand English, or those that are Ukrainian or speak Russian, to be able to come on. So we are going to archive this, and we're going to try to make every effort for translation. We are going to do that. But this is a map, and this is a map that was just pulled out from yesterday. And there's certainly an evolution of the way things are going to be. And you're going to hear from each of us, and our wonderful moderator, Nancy Thaler, is going to take this Nancy, I don't know if you want to say a journey or take us through a discussion point on what's going on and where we're going to lead from now. But this is definitely not going to be the end of our conversation about this. But this is a big deal that we in the AADMD wanted to come to and bring this information to those that are, in our network, and which is mostly everyone, and it's certainly growing around the world. So Nancy, I'm going to actually, in the interest of time, give this back to you in terms of beginning our dialogue and conversation.
Okay, great. Thank you. And it is an honor to be doing this, and I really appreciate the opportunity. We have wonderful panelists, and we have a growing audience. I see participants continue to join us. So we're going to structure this so that it moves quickly and everyone gets a chance to contribute. But before we go into the dialogue and the discussion, I'd like to ask each of you to introduce yourself by name, what your affiliation is, and where you are geographically right now. So Seth, maybe we can start with you.
Yeah, I was going to say, I'm sitting from the comfort level, I'm almost embarrassed to say, from the comfort level of Lumberton, New Jersey, which is 45 minutes out of Philadelphia, which is where I'm from. And I'm in a private practice and office setting, and I blur my background, but I'm in the comfort level of New Jersey. That's where I'm at. Yeah.
Great. Marissa?
Good morning. I'm a registered nurse. I specialize in the healthcare of people with developmental disabilities. I wear many hats. I'm an advocate, I'm a family member, and I'm adjunct faculty at Georgetown University.
Yulia?
Hi, I am Yulia Snyder. I'm a pediatric neurologist in Rochester, New York, working for Rochester Regional Health System.
Great. Thank you. Helena?
Hi, everyone. I'm Helena Kurylo, and I'm a Ukraine Program Director for Disability Rights International. I am based in Ukraine. Usually I live in Kyiv and I'm based in Kyiv, but right now I am in the mountains on the southwest of Ukraine in the village. So that's what you can see in my background.
And it looks lovely. Thank you. David?
Yes. Hi, David Evangelista, President and Managing Director of Special Olympics Europe, Eurasia, and actually patching in from New York City for the United Nations General Assembly, where we are, where one of our major topics is the support of individuals, children, and adults with intellectual disabilities in emergency settings, most namely that of Ukraine. It's a pleasure to be here, and thank you.
Great. Thank you so much. And Ladlina is not with us yet, correct? She's not online. Okay,
Right.
So hopefully she will be able to join us. Before we get started, I think that the audience, we'd be remiss in not asking Helena and Yulia for you to share with us sort of what is going on, where you are physically with the war and in Ukraine, and sort of to express to you what I think the Ukrainians know about the United States, that the citizens of the United States really very, very much support your struggle for democracy, and hopefully are supporting you in many ways. So could you just give people a little insight into what life is like right now?
I'm sorry, I'm going to give a word to Yulia because I'm trying to reach Vladlena. Maybe she mistaken the time. Okay.
Great. Thank you.
Well, at this point, I am also a citizen of the United States. I originally went to medical school in Ukraine. It was my motherland for 25 years of my life. So at this point, my knowledge about what's going on in Ukraine is primarily based on reading the news in various languages and talking to my friends and family who are still out there in Ukraine. And I guess what you would see on TV nowadays, I would say, is pretty accurate. I'm specifically from the eastern part with the border with Russia, from the town of Kharkiv, that I used to need to explain where it was, what it was. And unfortunately, nowadays, everyone is very familiar with that town. And they went under a lot of shelling, as I guess the Russian army was trying to reprimand for all of the advances that Ukrainian military has made. So they decided to get back to, Ukraine by shelling the civilians, I guess is what they mostly have been doing. Unfortunately, it's still about 1 to 20 hit rate for one military object. They hit about 20 civilian objects. And no end in sight, unfortunately.
Is your family okay?
You know, okay, I guess as a define okay, because most of them got displaced. Some of my friends and family were made to go back to Kharkiv because they were essential workers. So having kids in the city that is being bombed every single night is definitely rough. And, you know, they're still running to shelters. There's still air sirens going off. You know, I have some pictures of what Vladlena, who is a pediatric neurologist in Kharkiv, who we've been in communication with and trying to help the hospital where she is working, primarily taking of children with developmental disabilities. She has sent me literally pictures of shrapnel in their front yard of the hospital and pictures of emergency personnel right outside of the hospital doors taking care of something that, you know, they call it прильоты, something that just flew in.
Thanks for sharing that. Helena,
Yeah, I'm sorry. I was trying to reach Vladlena, but she's not like I cannot reach her either by phone or by internet. I'm not
I'm
sure
so
what's
sorry.
happening. She
So,
told me
yeah.
that she's probably gonna be here if she can, but again, the situation is very different, difficult and volatile. I would like to speak about something that has been there before the war and that has been exacerbated by the war. So we had about 100,000 children in institutions, but again, this number before the war, this number is not very exact because some of the children's counted were not. Oh, I can see.
Wonderful.
Yeah, great. So I just wanted to speak about those who were in institutions with intellectual and developmental disabilities before the war and how the war affected them. So as we all know, the war has not created a problem, a health crisis for people with intellectual and developmental disabilities. It just shed a light on that. And because some of the institutions from the East, and we've seen the map at the beginning where all the red color is so the institutions from there, some of them were evacuated, some of them were not, to either abroad or to the west of Ukraine. Yes, oh, thanks. So we can see this, Kharkiv is right now yellow, but it used to be very red, I would say, when the time for Kharkiv bombing was there. And but we can see also to Kherson, it's on the south right now, Kherson, Melitopol, Zaporizhia region. So there were a lot of institutions, and also Donetsk region. Some of them were evacuated to the west of the country. And just to give you a little of the background, people with most difficult and complex needs in terms of disabilities usually ended up in institutions under Ministry of Social Policy. So there's the Ministry of Healthcare, which takes care of health issues, and then the Ministry of Social Policy. So people who might have very severe medical issues, but also intellectual and developmental disabilities, would end up in institutions that were under Ministry of Health, of Social Policy. And in order to get health services, even before the war, they had to call services outside of the institution from the community. They did not have authority within these institutions to provide certain medical services and to administer certain procedures, which was a kind of a nonsense. And Sat can tell you more about that, how paradoxical it was when you have a child with epilepsy admitted to an institution that has to be that has to provide a 24-hour oversight over this child, and the institution doesn't have a license to certain medication, and they don't have they are not allowed to administer certain medical procedures, or for some, they don't have a capacity. So with the war, it all kind of came to its peak because some of the institutions under Ministry of Social Policy. And imagine Ukraine, it has 24, it used to have 24 administrative units, oblast, but together with those who are Lugansk and Donetsk and Crimea right now. So each of the oblasts had at least 2 or more institutions under Ministry of Social Policy, and every institution had at least 100 residents in that. So the health crisis was there before the war, but it was not so obvious, and it was accepted as a normal practice. With the war, and evacuated residents from the east to the west, the load on the staff increased, and also the international attention increased. So that's when the health crisis became obvious. It was not created by the war. It was just brought forward by the war. And I guess I will stop here, and I'll just can answer the questions. And
Okay.
I can see Dr. Vladlena Salnikova is with us, and maybe she can.
Right. That was such a good stage setting to understand the geography and the history and how things are what they are, and not to assume it's the war, but really an exacerbation. Vladlena, we are so thrilled that you could join us, and we're just beginning. And I've asked each of the panelists to share what's going on where you are now. How is the war affecting you? Just a little clip so people can get a sense of what's happening where you are.
Владлена, ви пропустили початок, Ненсі просила представитися нас всіх, розповісти, хто ви є, з ким ви афілійовані, де ви є зараз географічно, і як війна на вас вплинула.
Доброго дня, я вітаю всіх, дуже рада всіх бачити, особливо взагалі знати, що у цьому нашому світі, коли таке тут наскоїться, стільки в нас багато друзів і люди небайдужі. І нарешті ось і вивчаєте географію, і все несете, і нашу історію, і це дуже приємно.
I welcome everyone here, and I'm very happy to see everyone here and to see that in this time we have a lot of friends around the world, and that people are learning geography and history of the world.
Да, спасибо. Я, к сожалению, среди всех своих наук не успела постичь в довольной мере английский язык. Ну, хорошо, что есть девайсы. Я вас, в принципе, очень нормально понимаю, когда у меня переводит телефон. Так что, в принципе, общение для добрых людей, которые хотят общаться, не имеет границ. Спасибо.
I'm sorry, but among all the sciences I learned, I did not have time to polish my language skills, but thanks to the device, the modern device, we can all understand each other, and the communication between all the good people is possible.
Thank you so much. Just to say that we have people joining us every minute, and we have people from all over the world: Saudi Arabia, in Spain, Romania, Georgia, and all over the United States, from California to New York. So and with a number of comments about their sympathies for what's happening, and also examples of how people locally are organizing to help, and a number of physicians I think we have on the call, quite a number. So let's start with the where are things now? And Helena really set the stage really well about how things got to be the way they are now. But if we could go through the panelists from your direct experience, both Seth and Marissa both have been on the ground, and I think David has, assess the situation for us in a few sentences, a few words. Seth, you want to start?
Sure. So I've been a neurologist for many, many years, and so I'm an American, and my history and background in the field of developmental healthcare has been 30 years. I've been doing this for 30 years, and I do work in some of the United States and in New Jersey state facilities. So I have a background, but nothing prepared for me for working with Eric Rosenthal and Helena and Disability Rights International in going into Ukraine. And the emotions are all over the place. I'm actually wearing a Ukrainian shirt right now, so I'm very proud to be here and supporting Ukraine in every way, shape, or form. But I also have a sense of culture of what the Ukraine and other former Soviet Union countries are like in terms of their way of care. And in my visit in June to several institutions with DRI and the BBC, and was thrilled to meet with Richard Engel, such an amazing experience of being in the country, saw the institutions for warehouses in some respect, about people being there. And it was tragic. I saw a lot of tragedy for what I saw. And I think it's just a nature of the reality, and people that have developmental disabilities or in some way because of the culture, and not just Ukraine, but other countries, but Ukraine in particular, that we saw really are putting these institutions. And I was able to directly speak to medical directors when I was there with DRI and speak to them directly about how are you caring for seizures and how are you caring for spasticity? And tragically, they're not. They're really not. They're not really providing any great intervention socially, physically, or otherwise. I know, Marissa, you're going to be talking about that as well. But I was actually even asked to consult on someone. I know Helena was doing some of the interpretation with me and hearing this through the doctors, like shocking. What do you mean you don't have these drugs? What do you mean you don't do blood tests? How do you even treat people that are in recurrent seizures when you can't give certain medications like Valium? You mean you're not going to send them out to the hospital? You mean if they don't eat well, you're not going to put a feeding tube in? So what happens is people basically are dying early on, and basically the life expectancy is also is terrible. And I specialize in my work with the National Task Group on aging, and I was like, well, let me see seniors and older people. They weren't to be seen. They weren't seen as they're out living long enough, high risk of aspiration pneumonia and heart failure. So I'll let my other colleagues speak, but that was really what I saw in the institutions and trying to learn from, well, how is this elsewhere in Ukraine? So really the issue about global reach and perspective is really where I'm trying to help lead this conversation in the AADMD and elsewhere. So that was my thought.
Thanks. Thanks, Seth. Marissa?
Yeah, so just I will have some specific remarks, but another context setting is that from my visit in March with Disability Rights International, I really see Ukraine as in a position where the United States was certainly in the 50s and 60s. We have to acknowledge the fact that we still institutionalize people in this country. But it very much reminded me of my very early days working in an institution. Although, again, there's just such a lack of awareness of what people need and treatments and quality of life improvement. And it is heartening for me to see the work that Helena is doing with family members who have made that decision, just like family members were doing in the 50s and 60s in the US. No, we're not going to institutionalize my son or daughter. I'm going to keep them home with me, and they are going to work to build that system. So even in the midst of war, there's very important support to parents and children living in the community.
Thanks. Yulia, would you like to go next?
Sure. I think that, situation in Ukraine has certainly been evolving. When I was a medical student, that was sort of more of a framework that Seth was describing. Nowadays, from working with Vladlena and some of my friends who are pediatricians taking care of kids with disabilities, they really, at least in Kharkiv, which is the second largest city in Ukraine, so situation there might be quite different comparing with some other smaller towns in Ukraine. But based on what I've seen and ask questions about my friends who are taking care of these children and grown-ups, it has been very rapidly evolving for them. So some of these institutions now are being converted into rehabilitation centers for outpatient services for pediatric patients, PTOT, speech therapy, more really molding into the American model, if you will, but kind of really fast pace. They had the most recent ministers of health came with that background and knowledge, and they've been really trying to implement this and rather quickly in Ukraine. So I think that it really is probably spotty for Ukraine, but what Vladlena would be able to tell us is quite drastically different comparing with what Saf witnessed.
Thank you. Vladlena?
No. Hello. За последние... Галина может переводить или Юля? Да. За последние годы действительно произошла большая трансформация. Вы знаете, у нас идет реформы. И сейчас тем клиникам, которые действительно хотят развиваться, которые помогают больным, удается с помощью Национальной службы здоровья заработать достаточно финансирования, чтобы развиваться и идти дальше. Таким образом, в нашей больнице, насколько вот мы обсуждали с Юлей, насколько я могу вам представить, тут, к сожалению, с точки зрения психиатрии чуть-чуть не может подключиться моя коллега, ну, она бы рассказала более подробно. Но так как мы обсуждали, у нас действительно хорошие международные протоколы и технологии, и инструменты, и диагностика используется. Естественно, немножко социально я согласна, где-то мы в 50-х, 60-х годах в целом нашего прогресса. Ну, по крайней мере, наши врачи, наши больницы стремятся быть на хорошем уровне. И я так думаю, что это удается. Я могла с удовольствием бы вас пригласила или сейчас подготовила немного слайдов, если вам будет интересно посмотреть.
In the last years, there was really a transformation happening, and we do have reform in place. To the clinics that have desire and intention, there are resources available through the National Health Service, and unfortunately, my colleague from the psychiatry division cannot join us. And I think that this is my comment. I think she just doesn't have a link. There was a request in the chat to send her a link to our webinar so that she can join. So maybe while I translate, somebody can send a link and we can forward it to Tatiana. And so we really I continue the translation. So we really have good international protocols and instruments and diagnostics. And even though I agree that we're in the 50s and 60s in terms of our development, but we're trying to do our best, and we have succeeded. And I have prepared slides to demonstrate to you this.
I'd like
this is my comment as well. The slides came in too late today, and they are like, I have it, Vladlena has it, but I have not sent it to Courtney.
I just want to make a comment and to reiterate what Marissa said. While we have advances in the United States and maybe overall have made a little more progress, it is not uncommon to go into the field in the United States and find practices of the 1950s and people still not understanding and not getting the care they need. So it is always a process for every country to get from where you have been to where you want to go. So we are there with you in spirit. David, would you like to comment on what you see the state of affairs and at this point?
So first off, thank you very much, Nancy, and thank you to the to the over 80 participants from all over the world. It's really an honor to be here on behalf of the inclusion movement of Special Olympics. I'd like to thank first and foremost Seth for your very generous invitation. I want to extend the complete solidarity to Vladlena and Halina and to everyone. We stand with Ukraine in peace. We stand in inclusive development, especially for this population. I don't think I need to reiterate on this call the fact that children and adults with intellectual disabilities have always been the most marginalized and most isolated and invisible of demographics. But that invisibility and that marginalization takes significant, drastic, and tragic depth in emergency settings, very much what we're seeing in the country of Ukraine. We know that both in humanitarian situations and in man-made disasters, namely war, this is a population that it remains the biggest loser in a very losing argument. And so we at Special Olympics believe that this is a critical discussion that needs to be followed up by critical action. And I'm thrilled to hear that many of you on this call have been to Ukraine and have met with officials, have met with organizations, really pushing the global community to do more, to act immediately in a more incremental way. Special Olympics had, prior to the invasion on February 24th, Special Olympics had one of the most vibrant national organizations in Special Olympics Ukraine. In fact, one of our strongest local programs, as we call them, one of our local chapters was in the Donbass. In fact, we did a tremendous amount of work with the United Nations Population Fund and the football club Shakhtar, which remains a big partner of ours, but of course now our programming has been significantly strained. But we know that people with intellectual disabilities across Ukraine, regrettably, were living already in a defectology legacy from the Soviet Union. It's not my job to cast judgments, but the situational analysis is that the country of Ukraine still had very much literally a system of institutions. And I know that there was a big push, not only on the part of the United Nations, but in others in the government to very quickly begin that process of deinstitutionalization. Of course, this invasion has interrupted all of that. And what that's resulted in, regrettably, is the deepening of marginalization and the poverty of access that this population is looking at. Not only people with intellectual disabilities, but their families. Infrastructure has been significantly damaged and devastated. That includes, in large part, the health infrastructure. I, myself personally, in Special Olympics, have been doing a ton of work on the refugee side, having worked with Slovakia, Poland, Romania, Moldova, Hungary, and we're seeing the dire and acute needs of refugees coming over the border, everything from wash, infrastructure and sanitation work, to immediate needs, to hygiene kits. One of the situations that I've seen most acutely front and center is the need for motor development activity and stimulation for children with severe and profound intellectual disabilities. What I also have seen is an outpouring and an overwhelming support from regional and global actors. People are beginning to understand, maybe evidence of this call, and perhaps by way of this call, there has been a very strong focus on learning more so we can do more. I will leave it to Helena and Valena and others in the country to guide us as to exactly what we need to be doing to be of most support. But any of you listen, from Saudi Arabia to Spain to the United States to New Jersey, where Seth is, we need action. This is a population that is literally on the edge, and we can do something about it. Can we solve all of it individually? No. But can we make a significant impact together as a community? Yes. And I know that people with intellectual disabilities have the resilience to see through this, but we need to help them. We need to help them in that journey. Nancy, thank you.
Yeah, David, you are I would call it a mantra. Learn more so we can do more is really a theme for this and any other efforts people are trying to make to reach out to the Ukraine. So in that spirit, why don't we move right into a discussion about from Helena and Vedlina and the others, but beginning, as you said, with the people who are living this every day, what needs to change? What do you want the future to be? And how can the global community help? There are people on this webinar who may have the potential to not fix everything, but do something in some specific location or for some group or within a network in their country. So starting with Helena and Vladlina and then moving on, and David, you've been on the scene, what will help? Where do you want to take this and what will help? How can the global community help you? So Helena, why don't we start with you and then move on to.
I'm just gonna mention it to Владлена too. Владлена, ви зрозуміли, так? Що питання про те, чим ми можемо допомогти, що може бути далі зроблене. І я також хочу згадати, що я маю зараз ваші слайди. Якщо б ви хотіли їх показати, то я можу поділитися екраном. Але в мене є тільки дві оці останні презентації завантажилися.
Так, їх так дві є, якщо... дві останні. Так, одну з них, там різні формати, так. Там два різних формати.
I was saying that Vladlena sent me her slides, and if she wants to go first, then Courtney, can I share her slide?
Yes.
How do we do this?
Screen share at the bottom.
Oh, okay. So I am allowed to screen share.
Yes,
okay,
you are.
Let me do this now. Okay. So it's okay.
I mean, it's amazing though that
I'm
we are around the
sharing
world and can talk to
screen.
each other. Oh, there they go.
Here we go.
Yeah. So do you see my screen?
Yes.
Okay, Владлена, ви бачите екран мій?
Да, я вижу.
Тоді ваша презентація, і ви можете говорити. Кажіть мені тільки, коли перемикати слайди.
Ви перемикайте тут взагалі.
І робіть паузи, щоб я могла вас перекладати.
Да. Ну, это кратенько, меня все равно сейчас переполняют эмоции, даже слезы на глазах, когда вот, наши коллеги действительно так переживают за нас. Поэтому кратенько хотела что-то вам показать, как мы живем. Понимаете, это, конечно, для нас жизнь разделилась на две половины. До того 24 февраля, когда мы чего-то хотели, мечтали, создавали. И после, когда мы последние полгода, просто как-то выживаем, хотим что-то сохранить, хотим помочь. И, конечно, трудно сейчас что-то планировать на будущее. Каждый вечер мы засыпаем и думаем, когда будет тревога, не будет, прилетит ракета, не прилетит.
I'm very full of emotions right now, and I'm going to speak shortly about that. I have tears in my eyes that all our colleagues here are so empathetic with what is happening here to us, and that our life was divided into two halves. The one before that February 24, when we had dreams and we had plans, and then after the February 24, when we're only thinking about our survival, whether something will hit us or not, and it's two very different things.
Теперь можно следующий слайд. Это сразу это. Я хочу прежде всего поблагодарить и Юлии, Рочерський региональный фонд, всех перечислили, Рок Майдан, Фонд медичной допомоги Украина, Блессин, за то, что, в принципе, еще только с марта месяца, когда мы были совершенно растеряны и вообще даже думали, что это какой-то страшный сон, очень долго не верилось, что Юлия и все друзья, и вы в том числе, многие, оказались практически мгновенно через все трудности, мы получили очень много помощи. Это было очень важно, там, противосудорожные препараты, то есть остановилось у нас все, не работала ни аптека, ничего. И кто бы думал, из такого далека пришла помощь. Спасибо большое.
And I would like to thank Julia Snyder and the Rochester Regional Fund of Healthcare and the Rock Maidan and the Ukrainian American Cultural Association, Blessings International Fund Future for Ukraine, for everything, for all the help that you provided for us, because starting from March, we still thought that it was a nightmare, that it was not happening for us, but starting from March, we received a lot of help from such a far distance, and even like everything, like anti-seizure medications, everything that our pharmacy stopped working. We had no supplies, so it was very important for us to receive all the help that we got from you, from all of you.
Да, следующий можно? Следующий слайд. Ага. Да, это, в принципе, вот так вот выглядит наша больница, которая находится неврологическую помощь, психиатрическую, паллиативную, паллиативная бригада на дому, амбулаторная консультативная помощь и реабилитация. Вот это спектр услуг медицинских, которые оказывает наша больница.
So our hospital provides a lot of services in terms of neurology, psychiatry, palliative care. It's on the in the houses of those who need it, outpatient care and rehabilitation.
Дальше, да?
No?
Не переходит?
А зараз видно?
Да. Таким образом, у нас дети, поражение нервной системы, эпилепсия, церебральный паралич, врожденные пороки развития, психиатрические спектры, нарушения поведения, когнитивные нарушения, аутистический спектр и дети с неизлечимыми заболеваниями.
So we have children with epilepsy, with CP, with organic damage to the brain, with cognitive dysfunctions, and those who have diseases that are not compatible with life.
Да, следующий. Ну, это тоже, что я уже сказала, можно дальше. Дальше просто можно посмотреть, как мы живем. Довольно у нас много методик представила и большое оснащение. Мы, да, это собирали по крохам, по крупицам. И бывали у нас, конечно, много благотворителей и волонтеров. Поэтому вот такая вот база у нас собрана, очень много и физиотерапии, и психологи, педагоги, много специалистов.
And here you can see how we live and all the methodologies we've gathered piece by piece, and donors and professionals that helped us, and generally you can see how we managed to be.
Да, вы можете диктовать. Я постаралась буквально только, чтобы познакомить как. Конечно, в паллиативном отделении представлен как бы на международном уровне. Там оказывается и социальная помощь, у нас социальные специалисты, есть у нас духовная поддержка, психологи у нас работают отдельно для детей, отдельно для родителей, отдельно для персонала. Ну, вот такая вот такие вот детки.
In palliative care, we have social support, we have spiritual support, and we have psychological support for children, for their parents, and also for the care staff that is taking care of the children in palliative care.
Да, это я сказала дальше. Это мобильная бригада. Еще раз спасибо нашим друзьям. Можно чуть-чуть назад или уже поздно? Спасибо нашим друзьям, потому что благодаря Юлии и команде Рокмайдан у нас появился автомобиль, в котором теперь работает мобильная паллиативная бригада. Мы выезжаем на дом к пациентам, у которых нет возможности к нам добраться, и делаем коррекцию какого-то медицинского назначения или смотрим, как им лучше адаптироваться в домашних условиях, эрготерапевт и психолог. И все вот так вот это выглядит.
So this is you can see in pictures how our palliative mobile team works, and thanks to Julia Snyder and the Rock Maidan Foundation, we have a car that they can use to go and reach out to families that cannot come to Kharkiv. And thanks to these mobile brigades, they can adjust the medical prescriptions and do the correction in the home setting and help in this way for those who can who have not access to other services.
Да.
Дальше?
Да.
Дальше?
Да, вот так случилось. Ну можно предыдущий чуть-чуть. Это мы вынуждены, буквально все лето мы работали над тем, чтобы создать вот такое нам еще убежище. Теперь у нас в подвальном помещении обустроено вот такое убежище. Сейчас мы там ночуем каждую ночь, потому что это очень опасно, летит ракета, не знаешь куда. Ну, а днем только на время воздушной тревоги там укрываемся.
And
Так
here you can see the shelter in the basement of the hospital. This is the way we work the whole summer, and usually we spend a night there because we never know where the missile will strike. And during the day, during the air raid sirens, we go there.
Да, дальше.
Ну?
Да-да.
Дальше?
Да, ну мы ждем вот таких праздников, хотя тут некоторые были у нас и в военное время. Ждем, что наши дети, то, что вы говорили, как мы мечтаем о будущем, что у нас будем им дарить такие же праздники, потому что эти все дети для нас, они совершенно обычные дети, даже когда вот нас спрашивают, как вы можете работать в таком горе людей, мы говорим, это обычные дети, мы с ним точно так же разговариваем, мы с ними точно так же веселимся и поем и танцуем, так что вот эти наши мечты о будущем.
These are our dreams about the future, and this is something that was happening even during the martial law. This is children that we are trying to give a celebration of life every day, because sometimes we are asked how can we work with people in such a grief, but we say that we just treat them as normal children, and we're just trying to give them joy every day. And this is our dreams. How are we going to go forward?
Thank you. Thank you. I see that Tatiana has joined us. Oh, I'm sorry. I'm sorry. Allow Vedlina to continue and finish.
Ну,
Ладно, а вы
это еще
заканчиваете?
одни наши мечты. Еще одни наши мечты, что мы мечтаем еще биологическую обратную связь, хотели бы узнать, вот где нам развиться. Допустим, различные тренажеры, хотели бы узнать, какие вообще методики более прогрессивные есть у вас. Это то, о чем мы мечтаем еще тоже.
These are just our dreams that we would like to learn more about biological feedback and about other methodologies, how we can work with these children. And this is just something we are looking forward to and something in our plans in the future. But that's it.
Thank you.
Yeah, thank you so much.
thank
And despite your challenges, I can see you're moving very quickly into the future using biological feedback interventions to improve functioning. So congratulations to you. I see that Tatiana has joined us. We've been, Helene has been everything, including translator today. Does Tatiana want to respond to what you're hoping would change, how things could improve, and how the global economy could help?
Ми зараз бачимо, що Тетяна до нас приєдналася. Тетяно, якщо б ви хотіли щось сказати, то я тут. І про те, що, можливо, ви можете розповісти нам про те, як змінилася ситуація і як може допомогти глобальна економіка, так як Ненсі сказала.
Добрый день. Мне очень приятно участвовать в такой встрече, и я очень благодарна за возможность пообщаться с коллегами и за то, что такое глобальное сообщество интересуется состоянием проблемы в нашей стране и оказанием помощи детям, в том числе и с психическими расстройствами. Я хотела Да.
Good afternoon, everybody. I'm very grateful for the opportunity to be in this meeting, and I'm very pleased that the global community is very empathetic and not indifferent to the issues of children in Ukraine, especially of children with the special needs.
Я хочу два слова сказать о том состоянии психиатрической помощи детям до войны, до 24 февраля, в каком состоянии была, кто оказывался, и о том, что сейчас происходит с оказанием помощи психиатрической детям. И если можно, мои слайды включите, пожалуйста.
Я їх не маю. Ви мені їх маєте переслати.
Владлена Викторовна.
Где-то я присылала вам там чуть раньше мои. Может, я
Окей. Зараз.
Чуть раньше
I
моих.
would like to talk about the psychiatric help to
Шенина
children before the war, before the February 24 and after February 24. And we're trying to right now.
Может, я попробую, Галина?
Ага, пробуйте.
А вам не видно?
Видно. Нам видно екран. Включайте Шеніна. Так, включайте Шеніна 1.
Сейчас. Демонстрация. Так видно?
Зараз видно екран,
Так.
але ви не включили поки що презентацію.
Уже я включила.
Ну, тоді не видно.
I know that we'll have time also to post some of this information. This will be archived. So also just want to make sure in the interest of time too, that we will be able to post some of this information also.
Ми зможемо потім поділитися тою інформацією окремо, але прямо зараз її не видно. I'm just there. So Vladlena is sharing the screen. Well, was sharing the screen, and we couldn't see the presentation. And Shenina, I have this present. Is this yours?
Давайте, пока Владлена Викторовна пробует, я чуть-чуть расскажу.
I have this presentation, but it's just not, it doesn't open for me. Ваша презентація, на жаль, не відкривається. Я не розумію, чому я теж її маю тоді, просто вона не відкривається.
Сейчас еще раз не видно?
Yeah, I can only imagine before.
The format is invalid. Yeah, no.
So can Tatiana share with us what she would like us to know, and maybe we can post the presentation afterwards when we post the whole program.
То, можливо, ви просто, Тетяна, ви розкажете,
я тоді буду говорити
сказати, а ми потім. Але робіть, будь ласка, паузи для того, щоб я вас перекладала, добре?
Я зрозуміла. Окей. Значит, до войны у нас в городе 5-я наша детская больница является основной больницей, которая оказывает помощь детям с нарушением психики и поведения.
So before the war, our hospital, which is the 5th hospital in Kharkiv, was the only hospital that was providing help for children with different behavior.
Yes. Кроме этого, было отделение детское, стационарное в областной клинической психиатрической больнице и два института. Институт неврологии, психиатрии и наркологии оказывал помощь, и Институт охраны здоровья детей и подростков.
And also there was inpatient unit in the Oblast clinic, a psychiatric clinic, and also 2 institutes dealing with neurology and addictions and the psychiatry.
После 24 февраля 2022 года наша 5-я детская больница является единственным учреждением в городе, которое работает оффлайн и оказывает постоянно помощь детям с данными нарушениями.
But after February 24, our Children's Hospital, the 5th hospital, is the only institution, the only place that is providing help offline to children with these issues.
До 24 февраля в структуре нарушений психики и поведения и самыми распространенными были заболевания, это нарушение развития у детей и нарушение эмоций и поведения, которые начинаются в детском возрасте. А на втором...
Before February 24th, the most common things we had to deal with was developmental disabilities and emotional and behavioral disabilities in children.
А на втором месте были нарушения, связанные со стрессом и нарушениями адаптации.
And the second place after that were the disorders related to stress and disorders of adaptation.
В настоящее время мы ожидаем, что структура изменится этих нарушений. На первое место выйдут нарушения, связанные со стрессом перенесенным.
And as of today, we predict that the structure will change and we will have more people with stress disorders.
В настоящее время большинство детей, которым мы оказывали помощь, выехали за пределы Харькова, потому что в Харькове велись активные боевые действия, но значимое количество детей, особенно дети с инвалидностью, тем не менее вынуждены были остаться в городе и продолжают обращаться в нашу больницу за помощью.
Many children that we were helping left Kharkiv because of active hostilities that were happening in the city. However, a lot of children with disabilities that we were providing help stayed in the city, and they are coming to us for help, and we are providing this help. Це є, що ми зараз бачимо? Скажіть нам.
Ми бачимо перші слайди, ми можемо перейти к 7-му слайду, структура инвалидности. Значит, нарушения развития у детей являются, перед вашими глазами структура инвалидности детской, и мы видим, что больше половины это составляют дети, которые имеют нарушение развития, в основном нарушение развития спектра аутизма.
And on this slide, we can see the structure of disability, and we can see here that more than half of children that are receiving help with us have developmental disabilities, and mostly this is the autism spectrum.
В нашей больнице была создана бригада комплексная по диагностике и коррекции детей с расстройствами спектра аутизма.
In our hospital, we had a special brigade created to help diagnostics and correction for children with autism. В нас тут залишається 15 хвилин, хочу сказати, і до кінця вебінару підказує наш модератор, і щоб ми перейшли більше до того, як міжнародна ком'юніті може допомогти нам з тим всім.
Я уже подхожу, да, к этому.
I just voiced the question and that we need to think about the global community and how it can help us. And Tatiana is just coming to it.
Если можно, 9-й слайд. 9-й. Значит, в бригаду специалистов входят врачи-психиатры, психологи, логопеды и специалист по сенсорной интеграции и коррекционные педагоги. И у нас есть, вы видите на экране, тот инструментарий, который у нас есть в больнице на сегодняшний момент.
And into this brigade, there are psychiatrists, psychologists, speech therapists, sensory integration specialists, and correctional pedagogy specialists. And you can see on the slide the methodologies we use.
Да, у нас есть АДОС-2, это золотой стандарт, и АДИР, это инструментарий, который является золотым стандартом диагностики расстройств и другие. Но тем не менее мы испытываем потребность в инструментарии для улучшения коррекции и диагностики. На экране это видно сейчас. ПЭП, необходимость есть в ПЭП-3 и в специальных акустичных приладах обратной связи.
So on these slides, we see our needs in. Можно вернути слайд? Да, дякую. We see the need for improvement of our work with children with intellectual and developmental disabilities in psychoeducational profiles, third edition, and in the whisper phone, so the instrument for acoustic feedback without help of hands.
И следующий слайд – это диагностический тест Later-3 для детей, которые имеют интеллектуальные проблемы, нарушение речи или отсутствие речи.
And here we can see that we have a need in Later-3 instrument for those who have problem with speech and with communication.
Вот теперь на слайде вы видите детей и наших специалистов, которые оказывают помощь. Они проводят большую коррекционную работу, работают по современным методикам по ABA-терапии, оказывают логопедическую коррекцию и учат альтернативной коммуникации детей, учат адаптации, эргопедагогии и так далее. Спасибо большое за внимание.
And here on the slides, you can see our specialists that work with the ABA correction and with speech therapy, alternative communication, ergotherapy. And I just thank you for your attention.
Thank you so much. And I want to be conscious of the time. And we have all of the panelists now who have spoken and heard other ones speak. There are no questions in the question box, so I'm going to go through the list of panelists the way we started and ask each of you to speak to the future and what the global community can do, and any other point you want to make. So Seth, can we begin with you?
Yeah, thank you, Nancy. And thank you very much for everyone. And the stories are just rich and amazing. And thank you for sharing. I definitely think there's always a different perspective. I mean, I was there in a very isolated, way and institutionalized care and what I saw. And it's actually not great to actually see community care and community supports, which is so vital for families to be able to live and care for those individuals. I think the one thing that for me, in terms of next step, is a discussion like we're having now. Listening and hearing and understanding and forming these relationships. I think that's huge to be able to have hope for us in the international world and for Ukraine to work together and really understand and learn from each other. So I definitely feel that's a very important part for us to continue these dialogues. Understanding about what kind of care practices that we could provide. But I think also the issue is crises. I mean, I know that Marissa had some slides on this one also. We talked about on our prior talk that we did when we were there, is about there's crises right now of people with intellectual and developmental disabilities who basically are not getting great nutrition and pain and social isolation. So there's definitely an issue of strategic planning of what's needed now for people, because their time on this planet, sadly enough, I'm not really sure for some of it's really sadly really difficult for some, and also to help them in the future. So I think we have to think about some strategic planning in terms of priorities. And then of course, what does we in the international world, those on healthcare and social side of policy and whatever on the developmental side, where do we help and what does Ukraine need as we're now going through this discussion?
So you're talking about responding to the immediate crisis of children and people who have nothing and whose lives are at risk. Might not be everybody, but you certainly saw that. Yeah, Marissa?
Yes, and Courtney, please share the screen. Seth and I presented these points based on our observations. Now, again, we were observing in institutions because we were interested in seeing children that had been evacuated from the East and to see the conditions under which they're living. And certainly, there's absolutely no opportunity for transition. And in fact, I certainly applaud the need for better testing equipment, because I would say the presence of a developmental disability in some of the children, particularly in the children of Roma background, was questionable, that they even had a developmental disability in the first place. We saw wheelchairs, but we saw wheelchairs that were not fit for the person. Children were enduring restraints, handmade restraints, tremendous malnutrition, an absolute lack of treatment for correctable problems. And again, this is even more concerning, knowing that for children who do get to live in the community and get to live with their family, that is not the case. And of course, unrelenting boredom. There is absolutely no stimulation, oftentimes not even conversation for the children to benefit from. Next slide, please. So based on, and again, particularly these are the immediate needs of children and adults living in the institutions, that because of the serious health conditions that they are enduring, the lack of stimulation and the lack of an assessment system that could prevent institutionalization and the development of appropriate care in the community. There's also lack of independent monitoring. And we know that this is important no matter what country we're in. This is a highly vulnerable population. And without independent monitoring, we don't really know what's going on. Next slide, please. So we really do need expert people to come into the institutions who can help provide triage and assessments, determining the appropriate level of nutrition. Right now, everyone is being fed the same oral nutrition. And so if you are someone who needs a gastric tube feeding or maybe higher, more concentrated calories, you're not getting that. And that includes also positioning. Children and adults are being fed flat on their back, and we know how dangerous that is for health. And then we saw a significant number of children and adults who were in pain, either from, again, from lack of treatment for hydrocephalus, people exhibiting self-injurious behaviors, which we know the most important thing to do is to rule out any kind of health problems, looking at dental needs, et cetera. And then this team of experts really needs to be independent from the institution and have access to these important community resources that we know are available, even though they are constrained by the war. And then I just have a couple more comments. Next slide. So again, funds are needed to fund independent monitoring, making sure that as part of the monitoring teams, we include people with disabilities and family members, and that the teams need to be funded, not just a voluntary effort. Results of those monitoring teams then need to be publicly posted. And again, an assessment system that will identify the needs of children from birth so that the parents receive the resources that they need, and that other resources within the community, particularly public education, to accommodate all children. Thank you. I'll pass the baton.
Thank you so much, Marissa, for being so pointed with your recommendations. David, are you on with us still?
David had to get off the call.
Oh, okay, fine. Yulia?
Yes, and I think I just saw my 2 slides pop up on the screen briefly. There's only 2 slides. The first one is going over some of the work that we have done. and that's me and Alex Pasharkovsky, who's another child neurologist here in Rochester, working for University of Rochester, and I'm working for the counterpart large system called Rochester Regional Health. Now we are under umbrella of Rochester Regional Health Foundations, and since the war started, we've been sending prescription, non-prescription medications, medical supplies to hospitals across Ukraine, several different cities, eastern and western Ukraine, including a couple of shipments to the 5th Children's Hospital, and raising money for the ambulance that we are currently doing for another hospital. So I think that, you know, the situation is quite polarizing depending on where you look. I would say that what Lena just had to say a minute ago is kind of drastically different from what Marisa and Thef have been describing. Obviously, there are two you know, stories that are going on currently at the same time. So no, I don't think we really have to educate Ukrainian providers or people who are, you know, right now literally sleeping in the hospitals trying to provide care, like what Lena has been. She barely has been at home, and so her husband, since the war started. You don't have to explain and, you know, say that this is you should be doing things differently and, you know, judge them on how horrible things are. I think at the end of the day, they are doing their best and leaning over backwards, and these are the people who are literally heroes without capes. I don't know how many of us would be able to keep doing what they're doing, which is literally, there was like an example of shrapnel that Vladlena found in their front yard. So I think that understanding what needs to be done is clearly there for the medical community and for lay people as well. I think that we just here now live in this privileged country where resources are put together there, and just the level of wealth is quite different. I think at the end of the day, all it comes down to is, frankly, money. The reason why I left Ukraine as a star student who had every single door open to me was because I was making $9 a month, which was not enough to cover public transportation for a third of the month where I was doing my residency. You know, you can take any aspect of Ukrainian life. You know, there are people who are retired, who worked hard their entire life, and they are way below minimum wage, trying to survive, like planting potatoes in their backyard. So it's not just really people with developmental disabilities. It's no matter what you take, there's just literally the lack of financing at the end of the day, not the lack of the will, not even so much the lack of the knowledge, but the lack of the resources. So to answer the question of what do we need to do here, what we do need to do here is we need to clone Vladlena's institution across Ukraine. Every single city in Ukraine needs a place like that, because frankly, what she had to show is not that much different than what you would find in a smaller town outside of Rochester. And at the end of the day, what it comes down to, they do need money to buy that ABA test kit, and they don't have it. So I think it really comes down to training, equipment, and supplies, and handing over those tools to the people who provide care. It's not like they don't want to. It's not like they don't have the insight. It's just that there's no money in it, no money to do it. So bringing people for trainings, coming out and, you know, helping them to set up everything. But again, that requires fundraising, which is frankly why I'm doing what I'm doing, because at the end of the day, if you wanted to help, not just judge, not just make you feel better about it, not just say, ay, those Ukrainians, how dare they, like our people in the community, just give them money, they're gonna figure out how to make it work. Of course, with the help, of course, you can monitor it, but I think the biggest piece is just the financial piece.
Again, thank you so much for that. We're short of time. I want to give the floor to Helena, because I think that about what we need to do next. And I want to invite anyone that has an organization that has been sending equipment and money and helping, if you want to put your name in the chat and how to reach you, because there are people on the chat from around the world who are asking, what can they do? How can they contribute? So please, if you have a nonprofit NGA that can accept contributions toward a cause, please put that in the chat. Helena, would you like to kind of wrap this up maybe for us?
Yes, I mean, I'm very, very grateful for everything that has been said from the Ukrainian side, and I appreciate the work that Vladlena and Tatiana is doing, and Yulia as well. And this is true what Yulia said. We do need, they do need resources, and they will know where to put it from. But this is a very practical level, like down to details, and I would like to bring our common attention to the bigger issue, because it's not only this, like the people with intellectual and developmental disabilities, children with that, are not only coming from families to the hospital number 5. Unfortunately, there are a big number of them in institution, in residential, in congregate care. And unfortunately, people who want to help them, they go and help the institutions, which is definitely not something that helps each resident in the institution. So I would just like you to think about the importance of the families that can bring people to the specialists like Vladlena, like Tatiana, in community. And whenever we need to think about help to Ukraine, think about help in the community only. Please beware of helping institutions, because even though it might look like helping, it will definitely not do anything good. Like by institutions, I mean інтернати, дитячі будинки інтернати, and all that. I'm just translating it because the automatic translation may be different. And even, of course, we are aware that children in institutions, in internate, need help. But I and Disability Rights International, we believe that there has to be an opportunity made in the community. So we need to have options in the community for these children to get help, because this is the only way we can show them actually to the community, and we can show that specialized places that we've seen in the Soviet Union, specialized places for children and general people with disabilities, are not providing any specialized help. I mean, Seth can, I'm just, because I was like next to him interpreting for him, that he can sign, he can subscribe to each word that I'm saying, that specialized institutions are not providing specialized help for the people that need specialized help. And only in the community it can be provided. Only with the individual attention it can be provided. So just please, when you are trying to help Ukraine, think about that, because just helping them here and now, you might think you're helping, but in fact, you're making it worse for the future. So it's just, right now, I think it's a great moment for Ukraine, and I know it because I am in Ukraine right now, and we need to think about sustainability. So all help has to think forward and has to think about how this can be, prolonged into the future, how this can be made, sorry, I'm losing the words right now, how it can be made sustainable and actually worthwhile, because it's not just now. It has been happening before the war, as I said. It's happening now, but right now we have more attention. We have more opportunity to ask for help. So let's make it right this time. So that's what I'm saying.
I think we hear you, Helena, and I think that any country that has moved from an only institution model to a community model, it has experienced the challenge of creating the option while also trying to keep people safe and healthy in the institution until they can move. And when you're doing that, very often the debate about whether or not people should be in an institution of the community goes on. And so I think we hear from all of you the same tension we lived here in the United States, where we wanted to get people out but we couldn't get them out quickly enough, and we wanted to make them safe and healthy there until we could. And it's a complex challenge for sure. There's lots of work to do. And again, there are a number of people on this call who have asked, how can they help? And again, I invite, before we end this, to put in the chat, where do you send your check? Where do you volunteer? What can be done by individuals on this call, who are individuals, but who are also part of organizations that might contribute. It's been a vibrant chat box, lots of people chatting in. I think there will be great interest in getting the link to the slides and the video of this. And I see that Dr. Tyler, I think, Seth, do you want to close this off on behalf of the organization and talk about what might happen next?
Yes, I think Alan Wong, is this to you, or who jumps
Right.
in?
Thank you so very much, the whole panel, and Nancy for hosting this and moderating this. My heart aches for those in Ukraine, and I think that the panelists have shined a great light in this dark area. AADMD offers a voice for those without a voice. Collaboration and communication is a key to improving all lives everywhere, and equitable health care that's sustainable, as was mentioned before. And as Seth mentioned, it's incredible that we can have this meaningful conversation across the world right now as we do so. The invitation to you all is to continue this conversation on 2 platforms for free. One is our Helen Journal. It's a journal for clinicians, non-clinicians, those in community. And it's a free journal. We invite you to write any articles you'd like to it, to share the stories. Seth Keller has a beautiful article about his visit to Ukraine in this recent edition. The second invitation is to what we call our Mighty Networks, AADMD's Mighty Network. It's an app, and it's in an area that we can communicate and talk with one another, share ideas and resources, where to send things. And also this VGR here can be seen on this app as well and shared with other people. So those are things that we invite you to continue this conversation. It's more than just a conversation. It's an action plan, and we need to do it together and help Ukraine, as well as all people with intellectual developmental disabilities. I want to thank everyone that's added to this conversation. I wear other hats as well, and other organizations, Special Care Dentistry Association. We are in alignment with you, I'm sure. The International Association of Disability and Oral Health, the IADH. We are also there. So I think we can bring and raise the voice of this very important issue. So on behalf of AADMD, and I want to thank this student resident committee who hosted this, and Sophia for helping be our host on this very important topic. AADMD is with you, Ukraine, and our love, our prayer, and our well wishes for a better future. So thank you, everyone who's here and attended. And those are my final words. Anything else you want to end up with, Seth? You're the main person.
No, Alan, I can't add to that. I just want to thank you also very much. And this will not be the end of this conversation. And I'm sure we are now in planning for further discussion, including webinar. So keep watching out.
Thank you.
Thank you.
Bye, everyone.
Bye-bye. Thank you.
Thank you. Bye.